It's been awesome. The people have been so fun. It's been nice to network and meet our MCG people that we've partnered with and actually see them in person. So it's just really nice to network and actually meet people that have the same type of program that I'm part of at my hospital system. So it's been really nice.
It's really very good. The informations are great. I mean, from the first day attending the UR Physicians Forum, we attended that and we got a lot of informations from them. I mean, from top, the activities from top to bottom, it's really very informational. So it's a good resource for what we're doing right now. This is work and play at the same time with me. So I mean, the food is great. I mean, after hours, MCG dance was nice last night. So we were thinking of doing night swimming, but we did not. We did that. And, just even in betweens, just the lunch and the breakfast, when we sit around MCG people and or the payers or whatnot, networking with them and knowing what it is in their state, what they do, that's really fun to know because we get to compare what is going on in our institution and what is prevalent and what is up with them in East Coast and in West Coast.
I love the collaboration, meeting some of our providers that we work with on a day-to-day basis in person, having that opportunity to kind of network together, and also just hearing, the roadmap for MCG, what's to come, because we're excited to implement, the new automations coming down the road. So it's just really nice to kind of hear what's coming up and to strategize for what our care sources plan is for the future. We've heard it all week since we've been here, right, of what's to come with natural language processing, with AI. So I think all those things are things that payers and providers really need to be researching and be prepared to go towards. So certainly there's a lot of work to implement those, and you want to make sure that you implement them correctly. So no, we are very excited to continue to research and figure out how we can scale to grow as our company grows and what we can do for our members.
We met some fellow denial nurse managers, also payers that we normally coordinate with, just like Blue Cross Blue Shields, Tennessee, Humana, Highmark. We have some conversation. We shared some difficulty and challenges as a provider, and we were able to get some feedback on their part as a payer.
That's great. Yeah.
So it's a very interactive conversation. We were able to share feedback because sometimes it's nice to communicate to another party to get their mindset, to get perspective on how they view coming from the payer as well. So it's like an interaction, meeting into one junction on how to communicate effectively so we could devise some mechanism on how to move forward.
We learned a lot, and we did, compared notes with the other attendees. They were with denials, they were with even the physician advisor. And so we learned how it works out in their own facility, how they would handle the patient admissions from the emergency room to the admission. So it was, gaining a whole new perspective, not just from my world as a UR, utilization reviewer, but also from the physician's point of view, from the business revenue cycle and all that different worlds. And then you were allowed to ask questions.
The atmosphere is great. They treated you guys treat us really well. And I work with MCG all the time. I feel like I have to explain to people a lot at my work that I don't work for MCG. I work with MCG. So I really enjoy coming here and kind of seeing how like other providers, other payers are using the platforms and whatnot, and kind of implement that into CareSource and then the atmosphere, of course. It's a good time. Of course, it's always in a great location, and just the people you meet, the connections you make, and then all the different kind of like the breakout groups. You can learn a lot of things about the products that are being offered, the presentations about like it's not just MCG selling the product. It's like you guys bring in payers and providers to actually show like, okay, this is how they're using it. We're not involved with this presentation. Like, let's hear your stories. So it's really cool to like, it's more personal experience.
Totally a good time. Get to meet different people, getting to meet all your new information, what MCG has coming forward, learning about MHK, just the whole, love it.
With the advent of like Medicare ACOs, private Medicare, having to start following that 2 midnight rule, I wanted to make sure, I mean, I read the federal reg and stuff like that, but I wanted to make sure I truly understood the way MCG was rolling it out, what it meant for our physicians. But then more importantly, there's a bunch of payer type people here. So I also can understand what they're expecting in a way of documentation. So that again, I don't want rework. I don't want denials. I don't want peer-to-peer. I want to get it right on the front end. And so I feel the conference this year is huge for that because there is so much talk about it. Now being able to go back to my company with a high level of confidence that we are interpreting the reg correctly, that we are using it correctly, and that we are going to remain compliant because billing compliance is, huge.